everyone. Welcome to the 21st episode of Insight Webinar. This is a public health webinar series hosted by eHealth Africa, and this webinar enables insightful conversations with public health professionals on issues and pathways for improved public health care delivery. My name is TJ Swojumu, and I am the Communications Coordinator with eHealth Africa. I will be your moderator for today's Insight Webinar conversation. I'm welcoming you from wherever you are joining us. I'm quite excited about the discussion on the topic for today and the panelists that we have. It promises to be an exciting conversation. So you could do me the favor of sharing this link with your friends, people on your contact list who you know will benefit greatly from this conversation. So taking the conversation further, at least 140 countries recognize health as a human right in their constitution. However, the reality on ground is that many nations are not implementing legislations to ensure their populations are entitled to access health services. Now, as a matter of fact, as of 2021, the World Health Organization revealed that over 4.5 billion people globally were not fully covered by essential health services. Now, despite efforts to promote access to healthcare, challenges like lack of basic amenities, lack of safe drinking water, clean air, lack of good nutrition, lack of quality housing, and much more impact on quality health. This year's theme of the World Health Day, My Health, My Right, substantially captures the need to address these challenges to promote the right of everyone, everywhere, to have access to quality health care services. And so, riding on this, this 21st episode of Insight Webinar will dissect these issues and proffer recommendations. And so, having given that background, I'd like to take a welcome address from our Deputy Director of Programs in person of Dr. David Appan. So hello, Dr. David, are you there? Okay, it appears he is not available currently. So, but if he joins, we will take his address much later. All right, so I'm just going to go straight into introducing our panelists for this afternoon, and I'm very excited. Our panelists, they are seasoned experts and leaders who have invested their time and resources in promoting the right to quality healthcare. And so I'm just going to mention their names one by one. And when I mention your name, please unmute your mic and say hello to the audience. And so in no particular order, I'd like to recognize the head of Information Communication Technology, Aminu Kano Teaching Hospital, in person of Mr. Hamad Hashim. Hello, sir. It's good to have you
hello.
here. Hello. All right. Also, I'd like to, recognize the Senior Technical Officer at the African Center for Disease Control, in person of Dr. Charles Akatobi Michael. Hello, Dr. Charles.
Hello, audience. Good to meet you all.
All right, thank you. Good to have you here too. I also like to recognize the presence of a consultant physician, Bayelsa State Health Management Board, in person of Dr. Maria Imawabang. We are so glad to have you here, Dr. Maria.
Yeah, I'm glad to be here too. Good day, everyone.
All right, thank you. And last but not the least, I would like to recognize the presence of Dr. Wenayon Simeon, Research Associate, TGI, Sydney, Australia. Thank you so much for sacrificing to be here today, Dr. Wenayon.
Thank you very much. Hello to all our audience. Thanks for being here.
All right. So I'm just going to quickly go through the profile of our panelists, after which we will go on a short break, play a little video, and then we'll come back and we'll begin to take questions. Please, I want to inform all our viewers, listeners, that as the conversation goes further, the chat box is open for you to put in your questions, the Q&A box. Please send in your questions there as the conversation progresses, and we will take it. All right, so the first biography I'll be reading is that of Mr. Ahmad Hashim. He is the head of ICT at Aminu Kano Teaching Hospital. Aminu Kano Teaching Hospital is arguably the largest teaching hospital in northern Nigeria, and Mr. Ahmad is responsible for overseeing the institution's IT infrastructure, security protocols, and technological advancements. He is recognized for his unwavering dedication to leveraging technology for the good of society, and his commitment to driving innovation and excellence in the field of information technology is unparalleled. With over 24 years of experience in the field of information technology, Mr. Ahmed's track record, of success is coupled with his extensive knowledge and leadership abilities, and all of this positions him as a respected figure in the Nigerian IT landscape. Now, coming to Dr. Maria Imalbong, she is the consultant physician with the Bayelsa State Hospital's Management Board. She's a field epidemiologist and currently the Director of Medical and Dental Services with the Bayelsa State Hospital Management Board. She's an experienced physician with a focus on preventive medicine and hepatology. She strives to promote overall wellness, and she's committed to providing comprehensive and personalized care to patients of all ages. She has also authored, co-authored, and published research articles in academic journals. One of such research papers is the use of long-lasting insecticidal nets among women attending antenatal clinics at a tertiary hospital in Bayelsa State, published in 2019. Also, we have Dr. Charles Akataobi Michael. He is the Senior Technical Officer, Africa Center for Disease Control, Eastern Coordinating Center. Dr. Charles currently works with the Africa CDC. As I've said, he is a field FETP trained epidemiologist with 14 years of substantial experience in immunization programming, health workforce development, public health emergency preparedness and response, and general health system strengthening. Specifically, Dr. Michael has worked at different public health management positions to support prevention, response, and control of outbreaks of infectious diseases, including polio, measles, cerebrospinal meningitis, cholera, Ebola, avian influenza, and COVID-19. He's also experienced in strengthening disease surveillance and immunization systems at district, state, national, and regional levels in Africa. Last but not the least is Dr. Wenayon Simeon. He's a clinician in New South Wales, Australia. Dr. Wenayon is a medical doctor, public health physician, medical epidemiologist, and researcher who works as a clinician in one of the hospitals of New South Wales, Australia. He has an intrinsic passion and drive to impact the world of medicine and public health through research, innovation technology, and evidence-based decision-making. Dr. Simeon has extensive public health experience, having worked several years in the Public Health Department of the Federal Ministry of Health, Nigeria, and also in the Africa Field Epidemiology Network of Nigeria. He has worked as a research officer in the Kirby Institute, University of South Wales, Australia, and as a research associate at the George Institute for Global Health, Australia. So, ladies and gentlemen, these are the profiles of our panelists this afternoon, and it promises to be an exciting journey. And so before we kick off with the conversation, let us quickly watch a short video on the World Health Day theme titled My Health, My Right. All right, so please cue the video.
We join the world to champion the right of everyone to quality healthcare services. Of course, our health is our right.
Oh yes, access to safe drinking water is my right. So I stay hydrated by drinking more than 2 liters of water daily.
I schedule periodic health checks to address potential health concerns. Of course, my health is my right.
Of course, my health is my right. I keep fit with constant exercise every day.
My health is my right. That's why I wear a face mask, because I deserve clean air.
Of course, my health is my right.
I eat a balanced diet every day with enough fruits. Oh yes, my head deserves good nutrition.
Of course, my health is my right. I take at least 5,000 steps every day to improve my physical and mental health.
Take charge of your health. Prioritize self-care. And remember, your health is your right. Happy World Health Day.
All right. Thank you very much, and welcome back from that brief video talking about your health, your right. And so I'm going to jump into the question, and this is going to go to everybody around. So the theme for the World Health Day 2024, just as we've watched, is my health, my right. And so the question is, from your own perspective, what does it mean to you? So I'm just going to, call us, one by one. So I'd like to take Dr. Charles first. Dr. Charles, World Health Day theme for this year, my health, my right. So can you provide us a brief overview of what this theme means to you?
Thank you so much, moderator and viewers. Just to say that when you say my health is my right, for me, it is an affirmation of taking charge of your right to good health, maintaining a balanced diet, ensuring you're mentally, physically fit and healthy. And this takes into cognizance a lot of issues and parameters. It means that you need to maintain your health to be able to ensure your right to life. Nobody really wants to die. Everybody wants to live. But living a life where you live consistently with debilitations, or you're sick and you cannot actualize your dreams, actually is not a worthy life in that sense, especially when it lies within you to be able to create changes that make you live a healthier life. So it means that you need to take into cognizance what you eat, where you live, your environment, how you do your work in such a way that your work is not filled with stress, meaning that you're able to appropriately plan your work and do what we call a work-life balance. You need to be able to educate yourself with the right information that keeps you healthy. And you need to be able to have access to affordable and quality healthcare services. And such services, which many of us don't take cognizance of, is the service of routine medical checkup. Okay, especially in our part of the world, in Nigeria, for example, people only think that they need to go to the hospital when they are sick. But we don't know that the aphorism that says that prevention is better than cure actually starts with your health. So for me, my health is my right means that the onus lies on me to do all I can do to keep my happy, productive life. I should be able to enforce that right, just like I would want to enforce the right to life. Thank you.
All right, thank you very much, Dr. Charles. That was quite detailed. All right, so let's go to Dr. Maria. Dr. Maria, what does this theme, what does it mean to you?
Okay, thank you, Tijesu. So, like you mentioned earlier in your opening remark, the World Health Organization has stated that over half of the world population actually do not have access to quality health services. So that's one of the things that brought about the theme for this year's World Health Day. So the theme of World Health Day 2024, which is my health,
Okay,
my right.
we can't hear you, Dr. Maria. I don't know if it's just me.
Yeah, I think it's from you, Moshe, because we can hear her.
Yeah, I can hear her.
Okay, I can hear you.
All right, so the theme of World Health Day 2024, which is my health, my right, was actually chosen to highlight the right of everybody, not just some people and not in some places, actually to highlight the need for everybody everywhere to have access to quality health services. That's actually in all its totality, like we've mentioned previously, meaning having access to clean drinking water, access to clean air, even access to health information and health education. All that comprises what we're talking about. So it's important to note that at this stage, we still have parts, communities in our country where we have people who still drink water from the same source where they're passing fecal matter into. As in, you physically see them, one corner, somebody is pooing, passing feces into the water, and somebody just nearby is scooping water from the same source to drink. So we still have that, meaning we're still a far cry from having health as a right. So I think that's basically what the World Health Day, the theme for this year, is trying to draw attention to.
All right, thank you very much, Dr. Maria. So, Mr. Hamad, from your own perspective as an ICT personnel, I'm interested in hearing your own perspective. So, what does it mean to you?
Yeah, thank you very much. Well, for me, actually, I look at the theme as like an advocacy theme, which is actually aiming at promoting quality and good health to people at all levels, even from the urban and rural areas. But personally, for me, if you are talking about health as a right, it's quite beyond the right to health. Because I believe productivity largely depends on the quality of health a human person acquires. So if the productivity of human person depends on his health, so we still begin to think about even other related rights, because if the right to health is upheld and other rights are neglected, I believe we will be quite far away from our destination. For example, like right to education. The type of education someone's acquired determines the quality of life that person is going to have, or the quality of his health. And that we have the right to work, for example. Everybody has a right to work. So if people are working, for example, you cannot compare somebody that is working in a garden, for example, somebody that is having access to natural environment, and the other person that is working in a factory, for example. So we need to begin to relate how other rights affect the health rights actually, because I don't want to be looking at health rights individually, because I believe every other right is trying to support that right. Whenever you touch my right of movement, it will affect my health. If you touch my right to acquire property, it will actually affect my my health. So I think it's high time. I like the thing. It has come in the right time, and it's good that we begin to talk about health as a right, but notwithstanding, we need to be looking at how other rights affect the health rights. Thank you very much.
All right. Thank you very much, Mr. Hamad, for that unique perspective. I mean, if you follow what he's saying, we can see him, extending towards the aspect of, mental health, how the environment and, other social factors might also impact the health of human beings. Thank you very much, Mr. Hamad, for that perspective. All right, so Dr. Wenayan, please, what do you have to, say from your own perspective? My health, my right. What does it mean to you?
Thank you very much, Mr. Moderator. Riding on what every other panelists have said, like we all know, health as defined by the World Health Organization is not just the absence of diseases or illness, but it's a state of complete well-being, and it cuts across every aspect of life, physical, spiritual, mental. It is holistic. And I think what the World Health Organization is trying to drive at is that everyone will take personal responsibility of their health. That is why it is used my health, personalizing it, and my right. If you ask people about a right, people know a lot about human right, but most often we neglect the aspect of health as a component of that human right. And indeed, it is upon that every other aspect of life and productivity is based. So we as individuals that eventually make up the society, make up nation, we need to take responsibility for our right. The decisions we make concerning our right, the choices we make, we need to be very proactive about it, and we need to be very deliberate. And at the same time, health should be seen and in such a way that when it is given to an individual, we should know that we have right to health being made available to us, irrespective of our background, irrespective of our socioeconomic status, irrespective of our gender. We should have health available to us. And not only that, it should be accessible to everyone. And when we talk about accessibility, it should be both not just geographical accessibility, but even in a non-discriminatory one, I should access health irrespective of my status. And then it should also take into consideration the financial aspect as well. So there should be no economic discrimination based on my financial aspect. And then it should be such that it is acceptable unto every individual, putting perspective, the ethics and the sensitivity in the aspect of gender, and not just that, also culturally cultural acceptability. And then we should know that we have right to quality health, not just anything that is available. It should be quality. So all those components makes the right of individuals' health. Thank you.
All right. Thank you very much, everyone, for opening with that and sharing your perspective. Okay, so I'm going to throw the next question to Dr. Charles, but however, please, as we go further, I'd like us to be a bit economical with time so that we're able to touch more questions, and provide perspective to a far-ranging number of aspects with regards to this topic. So I'm counting on us to be able to do that. All right, so Dr. Charles, tomorrow is World Malaria Day. As you may know, for everyone listening, tomorrow is World Malaria Day. So to what extent do you think citizens, especially people in underserved communities, to what extent do you think they have earned the right to live malaria-free? Dr. Charles.
Thank you, Mashud. So first and foremost, every citizen of a country have earned the right to health, including those living in underserved communities. Even to even say clearly, if we need to prioritize specifically, or we need to disaggregate this right to health, I would say that those in underserved communities should have a greater priority. You know why? Because if you look at the dynamics of food production, especially in most developing countries, you find out that people in rural areas are the major workforce that feed the nation. So they should be prioritized for all health intervention. And this is actually in agreement with the World Health Day team, My Health, My Rights, and also in agreement with the World Malaria Day team accelerating the fight against malaria for a more equitable world. The underlying word here in this theme for me is a more equitable world. It means that health equity should actually be prioritized in health programming. I think all of the speakers that have made comments in the first question had alluded to the fact that we need a world, we need countries to be able to implement treaties that they've signed to, where all citizens everywhere are able to access quality, affordable health services, irrespective of their geographical location. And this qualifies people in rural areas to get this kind of services. Additionally, I had worked in Nigeria for about 9 years on the polio program. There was a time that white polio virus was actually following nomadic routes. You know, these Fulani herdsmen that graze cattle from one geographical location to the other, and they usually take bush paths. While we were battling with people in communities, vaccinating people in urban places and peri-urban places, we forgot about this population. At a point, they were seeding white polio viruses to the larger population. So what it does mean is that enforcing the right to health of every citizen protects every other citizen, because diseases does not know, or infection-causing agents does not often know your status. So when you don't prioritize these people and give them access to appropriate malaria intervention, they perpetuate malaria in the communities, and subsequently it gets to even the urban areas where you try to protect. So they've earned it. They've earned it by virtue of the fact that they're simply citizens, and it is their right to be protected health-wise by their country. They've earned it because they're a contributing workforce to feeding the nation. They've earned it because if you do not give them access to this intervention and also prevent diseases in their populations, they become risk to every other person in that community. So for purposes of time, I will stop with these three basic comments. Thank you.
Thank you so much, Dr. Charles. Thank you so much. Just like you have rightly said, infection-causing agents, they don't discriminate, and so everyone who is a part of the workforce, everyone who is a citizen, everyone who is human and living on the landscape has earned the right, to quality health care. All right, so the next question will go to Dr. Maria. Dr. Maria, what do you think are the major barriers to quality health care in rural communities?
Okay, in rural communities, I would say the major barriers are access, availability, and then access. Those are two issues, because in one instance, you could actually have the physical building available in those rural communities, but when you get there, there's nobody there to man those facilities, or even where there is someone, then there are no equipment whatsoever for the people to use in attending to whichever patients come there. I think that's a major barrier. And we have issues where one man is everything in that health center. So we've visited health centers where we get there and the place is locked up. Why? Because the person who is supposed to be in charge has gone away for some other thing. So for the duration he's away, that place is locked. So I would say availability or lack of those healthcare facilities in the first place is a very important barrier. Excuse me. Then shortage of healthcare facilities too, those rural areas. Because if we actually do a head count, we would find out that most of the facilities that seem to render services that are a bit that we could call quality health services are all located in the urban areas. So you don't have health facilities that can actually offer qualitative services in the rural areas. In addition to that, we don't have specialists agreeing to work in those rural areas. So there's also a problem of manpower, and then having a problem of specialized services. So we have specialists all clustered in town with nobody. Probably there are no added incentives to encourage the specialists to actually work in those rural areas. So even something as simple as transportation is an issue. So a real life experience, at a point we had a doctor working in one of the riverine communities in Bayelsa State. So he actually was attending to a pregnant woman who came in the middle of the night and had an acute asthma attack. So he did all he could. And at the point where the oxygen in that riverine community ran out, he was able to refer the woman to go to town, so that the oxygen could be continued. Unfortunately, the woman had to cross a river to be able to go to the closest health facility. And they were involved in a boat incident, and the lady died together with her relative who was taking her across. So I think location to that are also hindrances. Finally, we also have even where the government rural areas, we have some communities deliberately refusing to give like choice locations for hospitals to be sited. They'll rather prefer to site hospitals in remote parts of their community for whatever reason, because they don't see the hospital as something. Nobody wants a hospital to be sited close to their houses. So we've been to communities where the members of the community need to use a canoe to cross to be able to access the health facility that was meant for their community. So, and one will ask to give the government a portion of land where there is very limited access to. So I think those are some of the issues I can highlight. Thank you.
Thank you very much, Dr. Maria. That's quite extensive, and that's a sad story you shared there. And this is the reality of a lot of people in rural places in Nigeria. All right, so I would, because of time, I will just still throw the same question to Mr. Ahmad. I'm hoping that you can just briefly share your own perspective. From your own standpoint, what do you think are the major barriers to quality healthcare in rural communities?
Yes. Oh, thank you very much for having me once again. Actually, in addition to all the problems mentioned by Dr. Maria, for example, in northern Nigeria, we have another major problem that is deterring people from accessing quality health care. Let me give you, for example, in Kano State, we have 44 local governments, okay? In each local government, there is a village. For example, we have municipal local government. It's a local government in Kano, and there are 59 villages in municipal local government alone. So the lists, local government with villages, I think is Warawa local governments. So, and these are communities whereby you find not less than 1,000 people living in each village and with their own ward head. So I can't imagine each of them having a healthcare facility. Just in one local government, you require 59 different healthcare facilities. So the way these villages people are living in their own comfort zone, if they can come together, like you put 10 villages together to form a bigger community, I believe you can give them one hospital that will be enough for all of them. But the major challenge is that you have to reach out to each and every village to deliver services. So in just one local government, you have 59. There is a local government with 82 villages, 82. And each one, like I have said, you have not less than 1,000 people living in that community. They need school, they need road, they need hospital, and they need all other social amenities waiting for them to get it. And the road, the school, and what have you also contribute to the quality of health of such individuals. So for me, actually, we have bigger problems. We are quite far away from achieving the health delivery services in our community. In 2012, there was an effort by one NGO, because they look at the type of terrain, the type of places people are living. So they propose mobile healthcare services using bus. So it was quite a great effort. They use a lot of technology to make sure that they reach out to those villages. They made a timetable, and as they go, they increase the number of buses. Then actually people were very happy, and a lot of health issues were being addressed using that mobile health facilities. But after like a year, the program died, and people started also crying out for health solutions. So for me, in Kano, actually, or in northern Nigeria, our type of settlement is largely contributing, is hindering us from, because I was born in a village, actually. I spent my first 20 years living in a village, so I know what a village is and how, or what type of life people are living in villages. So actually, this is one of our major challenges. And if this is addressed, I believe it will help.
All right. Thank you very much, Mr. Ahmad, for providing us with that very unique perspective. Okay, so I'm going to go to the next question, and this next question is for Dr. Simeon Wenayon. So we've heard Dr. Maria and Mr. Ahmad talk about some of the major barriers, to quality healthcare in rural communities. So now, how does amenities like safe drinking water, clean air, food security, and the likes, how does it impact quality health?
Thank you, TJC. There are some factors that we refer to as the determinants of health, and this varies from genetics to individuals' behavior, physical and physical environment as well, then even social factors. So when we talk about the safe drinking water, clean air, and food security, so these ones, they fall under the environmental and physical factors. Now, studies have shown that where people have access to safe drinking water and clean air, they are actually more productive, and the productivity cuts across different age groups. For kids, they are likely to grow well. Then for the school age, because they have good safe water, they are healthy and they're able to go to school. And in addition to going to school, they are well educated, and then they can take decisions that will prevent them from falling sick. And by so, they are more likely to come out of poverty and also live good life. And then for the adult population, access to safe water also prevent some waterborne disease. Same with clean air, airborne diseases are prevented. And as a result, people become more productive. And it also prevent the health system from being overwhelmed, because when those things are not there, people get sick. A lot of people attend hospital more. The health resources are rapidly utilized, and health workers are overwhelmed. And because they attend more of to the hospital rather than their work, the quality of productivity is reduced. And that also impact on the economy as well. So it's just like they are all interrelated. So in order to ensure that people have access to quality health, we need to ensure they have access to good water, safe water, and then the quality of air around us, as well as good food. I will stop there because of time.
All right. Thank you so much, Dr. Wenayon. If you're just joining us, welcome you to Insights Webinar, the 21st episode. We have 4 panelists, and today we're talking about promoting health rights of underserved communities. So this next question is to you, Dr. Charles. While Dr. Simon was speaking, he touched on behavioral change, right? So I want to ask you, what kind of behavioral change is needed to promote a healthy lifestyle, especially in rural communities?
Okay, so first and foremost, there needs to be a change in health-seeking behavior among rural dwellers. Why do I say this? I think there's a perspective that is very prevalent in rural communities where they only try to seek health services when they have health incidences. And even at that, they don't until it becomes critical. You know, naturally, self-medication is a common practice in Nigeria, and is even much worse in rural communities where people will take 1 dose of antibiotic for for a perceived infectious disease symptoms. And they take that, they feel a bit of relief, they stop. And that is even contributing to antibiotic resistance, antimicrobial resistance that we're currently getting. Another thing is that I've seen situations where in rural communities we've struggled to facilitate uptake of immunization. Yes, one of our colleagues talked about accessibility and availability, but again, the health-seeking behavior is a critical challenge. There are communities where you struggle even with the access and availability of immunization services, which will ordinarily prevent a lot of infectious diseases, especially among under 5 children. But you see rural dwellers not wanting to take this because of perceived, sometimes misinformation, sometimes because they have other health needs that they think are not being taken care of, and all of that. So that mindset about health-seeking behavior need to change. Another one is basic hygiene. I remember I was somewhere in Kebbi, and during the opening ceremony of an event, we had a traditional ruler talk, and the first thing he said is that the first medicine or the first preventive measure is sanitation and basic hygiene. So situations where we have cholera outbreaks can be avoided by simple basic hygiene. So that attitude of sometimes open defecation and all of those those other practices that make our environment stay dirty and unclean creates avenues for infectious disease. Another one is changing mindsets about many infectious diseases. Some of them have cultural beliefs that they hold tenaciously to. And this, I feel that with the right information through proper community engagement in both planning and implementation of health services, we need to change those perspectives, because sometimes, again, those are major hindrances where people have those perspectives. I remember one time in Jigawa, there was a community that felt for male children, anything made of steel, like needle, should not prick them. So for a very long time, they refused to take immunization services. And that's just cultural belief. So those kind of behavioral change, those kind of perceptions need to change. And then, of course, lastly, the taking good drinking water, we've talked about that, personal hygiene, change in behavior in terms of health-seeking behavior, and also enhancing protective measures. Like for malaria for example, you give mosquito nets and they use it to make garden to protect birds from planted crops. So rather than seeing mosquitoes in beds at night, you see them outside and they still sleep, So these are some of the things I felt that to highlight, yeah, for want of time. Thank you.
Thank you so much, Dr. Charles, for that insightful answer perspective. So I'm going to come to you, Dr. Maria, but just before I come to you, I want to show the question to Ahmad. And please, if you're watching, you can put your questions in the Q&A box and we will take it. All right, so for Mr. Ahmad, how can information technology help in bridging health right gaps, especially in underserved communities?
Oh, thank you very much. Number one, actually, broadband penetration is very, very low, even in the urban areas, the place of the rural areas. So, whatever technology you want to actually deploy, especially now that we have advanced technologies that requires intensive data application. So actually broadband penetration is one of the key things that needs to be addressed. Number one, there was a survey in 2019 across Nigeria to check what fiber presence in all the communities, all the local governments in Nigeria. So actually, if you look at that research, the result was not actually good, because you need fiber penetration everywhere to deploy broadband so that people in the rural area can have access to technologies, health-wise, education-wise, and what have you. So, for example, it's only Lagos State in Nigeria that all the local governments have fiber backbone. All the 20 local governments in Lagos, they have fiber backbone. But when you go to Bayelsa, only 3 local governments out of the 8 local governments have fiber backbone. If I can remember, maybe Sagbama and Yenagoa. So you look at the statistics, if you come to Kano, 26 out of the 24 local governments have fiber backbone. And we are talking about the local governments. We are not talking about the actually core rural areas, which they have the fiber backbone. So based on that, what I can only recommend is that if we can tweak USSD services, because in most of the villages they have 2G services. I believe they can we can use USSD to give them some basic consultation, especially if the USSD will be integrated with maybe voice over USSD or LTE, voice over LTE. When we integrate these technologies together in the rural areas, maybe we can be able to. And why I'm saying voice, even if it is text-based, most of the people in the rural community, they cannot write and they cannot read. So, but you have to use voice-based approach. And one of the major shortcomings of USSD actually is available in almost all the communities, but it may not on its own carry voice. So you need to integrate it with other technologies so that it will carry voice. It will help in consultations. They can consult doctors in the rural areas. Maybe they can send a voice and ask some questions, maybe medications, or even interface-based approach, whereby they can have some access to some basic interface, because most of them are using keypad mobile phones. The smartphones actually no longer, they can't use it there because you can't find 3G in a remote area. Even 3G is not available there. They can only make call and make text. So for me, what I've been thinking as a solution is how we can tweak USSD, combine it with voice, so that we can deliver some services. It's a project that I believe we can consider. Thank you very much.
All right. Thank you, Mr. Ahmad, spoken as a true ICT professional. I'm hoping that people who are listening right now can, pick, a thing or two from what you have just shared. And maybe, there might be some collaborations from people, some project ideas can be birthed from what you have just shared. All right, so Dr. Maria, at an individual level, right? What are the steps we can take in a bid to prioritize healthy life?
Okay, the video that was played actually captured a lot of those things that we should be encouraged to do on individual levels.
Yeah.
So first of all, I think it's important that we establish some establish our goals. What really do you want to achieve? And then you take little steps, and at the end of the day, you can achieve what you want. So the important things would include staying active, meaning we should exercise at least 3 days. That's it. We need to eat healthy, eat a proper balanced diet, and also stay hydrated while at it. So we encourage at least 3 to 4 liters of water every day, in addition to eating balanced diet. It's also important to manage our stress levels. We need to find a way to, whatever relaxation technique works for you, you need to incorporate that into your routine. We need to get regular undisturbed sleep every night. I think those are the is lacking for the Nigerian populace, I would say, is lack of regular checkups. We just continue on and on and on until that. Maybe once every year, you should go in for a checkup, whether you feel well or you don't. I think that's also one thing that we should encourage everybody to imbibe. Thank you.
All right. Okay. Thank you very much, Dr. Maria. Very solid point you just made. That truly in this, part of the world, people do not prioritize, their checkups, for various reasons. I think part of it might include what you spoke about earlier when you talked about access and availability. Some part of it also too might be just social and cultural norms. I remember Dr. Wenayan talking about people undermining the importance of safe drinking water, quality air, and things like that. So I'm hoping that listeners, would have a change of mind or a behavioral change as a result of some of these points, that we have shared here today. So Dr. Wenayan, I'd like you to also speak to the same question. What are the steps you think we can take, in a bid to prioritize healthy life?
Yeah, thank you very much, TJC. Like Dr. Maria said, basically for individuals, it boils down to lifestyle modification. And for me, I think I will look at it from the point of prevention, what we need to do in order to to optimize our health from getting, prevent us from getting sick. Like Dr. Maria said, rest well, eat well. I know that for most underserved population, access to good nutrition is a challenge, but as much as you can eat fruits, vegetables, yeah, those things can easily be reached. And then exercise regularly. And yeah, so then in addition to all those, I think it's very important that people who smoke, they stop smoking. Smoking has been attributed to a lot of diseases. Almost every disease we have smoking as is either direct or remote cause. And then cut down on alcohol. Then where appropriate, people should take vaccination that prevent them from getting sick. Now, having said that, when people eventually get sick, it is important for them, like you have said, my health, my right. They have the right to ensure that they seek treatment early, which we don't do. And then when people are treated, they should adhere to treatment, like Dr. Charles said earlier. People use antibiotics, and when they feel better, they forget about the remaining doses. Those things are very important. They should adhere to treatment, and not only that, they should also ensure regular follow-up so that they can prevent complication. Thank you.
All right. Thank you very much, Dr. Wenayon. So I have a question from someone online following, and I would want to appeal that we'll make it as short as possible. We might not be able to really go into the details, but let's just take a stab at it. All right. So this question is from Dr. Clarence. He says, how do we actualize the concept of universal healthcare for Africa? So I'll throw that to Dr. Charles briefly.
Yeah, so it's a mix of many stakeholders. There's the political will component, and we talked about regular checkup in rural area. How do people do regular checkup in primary healthcare facilities that do not even have simple blood pressure checks, instrument, and all of that? So it's a mix. There's the aspect that has to do with the individual. Accepting available services. The aspect that has to do with the government making available these services. So to ensure this, I think this kind of webinar provides the right education for listeners and for people who are able to talk to other people. But much more importantly, I think we need to increase advocacy to governments to see how we can actually make primary healthcare provide quality services. That's one way I think we can push that. There's a lot of treaties that have been signed. One of them is the Abuja Declaration, that was signed in our own country. We should try to enforce that by putting more money, the percentage, 15% that was earmarked for health in the budget to health, and ensuring that the money is used for health. I think those are some of the things. Let me give room for other colleagues to this. Thanks.
Okay, so briefly, Dr. Maria, do you want to just quickly chime in?
Okay, I think he has basically said it all. It's more or less a collaboration. So everybody needs to come together for that to be achieved. So it's not just the government alone or the government at one level. It's going to be a collaboration between federal, states, local government, as well as partners. And it's something that everybody has to collaborate for it to work. Even health providers also have their role to play for universal coverage to work out in Africa.
All right. So Dr. Maria, we don't have much time, and we'll have to bring this webinar
sorry,
to.
Can I just quickly add something to that?
All right, please do.
Yeah, just two things. I won't go deep into them, but because of time. One is that the concept of health insurance, that will help more people to access health, because when the out-of-pocket expenses is reduced, that will go a long way. And secondly is that it is intersectoral collaboration. Most of the factors that affect health are not just within the health system alone. They cut across every other aspect of life, education, agriculture, and the rest. So all those need to come together in order to strengthen the concept of universal health coverage. We just buttress this with one example from one of the studies I've done. Most of the people that work in the rural and remote areas, you notice that healthcare workers don't want to stay there, not because sometimes the health facility is there, the equipment is there, but they are also human beings. They have family. They don't want to live in rural community where their children will not have access to good education and other things. So as a result, they don't want to stay in such communities. So as we are looking at strengthening the healthcare services in community, education and other things that we also support the healthcare workers and the people in the community should also be implemented along. Thank you.
Thank you so much, Dr. Wenayon. All right, so let's do this quickly. Mr. Ahmad, can we take your final words final words, just 30
Yes,
seconds,
yeah,
1 minute, final words.
So maybe let me make it like IT wise. You know, we are talking about the rural areas. This webinar we are doing actually, they are supposed to be, because we are talking about the people that matters actually, they should be able to connect and hear what we are talking about. But unfortunately, because of lack of infrastructure, we can only talk on their behalf. So I hope we'll do more so that in near future we'll be able to connect with the people in the rural area in our next editions of webinars.
Okay, that would be a great one. All right, and Dr. Charles, final word, please.
Please, for my last word, permit just 1 minute I see a question that was personally addressed to me and I was called out on behavioral change. And I think that I wanted to say this. The theme is well taken, my health, my rights. And if you know, you understand that, as Dr. Williams had said earlier on, you personalize this. Maybe you don't have everything you need. We know there is poverty. But what's the place of poverty when you are giving vaccine that can protect your children? You say you don't take it because you've not been given food. So you are complicating it. That's double wahala for dead body. Okay? So I would rather say you change your behavior, and because the health is you that will die first, actually, even before government get to know you've died. So you should protect your health. Do what is within your power while we continue to advocate for government to do more. So do what is within your power. It's your right, and you're the one that will enforce it. Let's do that. From Africa CDC, I think we've also been pushing to see how we can see more governments take responsibility for the health of their population. So thank you for this opportunity.
Thank you so much, Dr. Charles, for that very powerful bit. All right, Dr. Maria, final words.
Okay, so my final words, I'll continue from where Dr. Charles stopped. Please, for our patients who come to the clinics, stop saying it's not your portion. It's your health and it's your right. So let's embrace change, embrace behavioral change, and also accept, you can have a patient staring at you, you've checked the blood pressure and the blood pressure is hitting 200, 130, and you tell the patient, and the patient says, it's not my portion. So please, so if it's not your portion, whose portion is it? So I think I'll use this opportunity to emphasize it's your health and it's your right. So please, 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 our health is our portion. It's not any other person's portion. Thank you.
Thank you very much, Dr. Maria. Thank you very much. All right, and finally, Dr. Wenayan, can you just give us your, last words on this webinar?
Yeah, my health, my right. So use your right. Any right that you don't use does not become right. So ensure you use your right, and that right is actually a preventative one before it becomes the one that you need to rehabilitate. So it's better to prevent than to get to the point where you need to be treated or cured. And sometimes it may be uncurable.
All right. Thank you so much, Mr. Ahmed Hashim, Dr. Charles, Dr. Wanayon, and Dr. Maria. Thank you for, sharing your wealth of knowledge with us. I can see people in the comment section just saying, when are we going to have, maybe slides or the summary of this meeting? And I believe that people have really gained, immensely from the conversation we've had so far. And that is why we have, Insight Webinar. This is the platform where we get to, talk about these issues. Thank you very much, for obliging to be with us today. We're so grateful. All right, so this has brought us to the end of Insight Webinar. I have a quick announcement to make, so don't drop off yet. We're excited to let you know that the 2024 edition of Insight Learning Forum will hold on the 31st of July, 2024. So, this is Insight Webinar. And last year we had the first edition of Insight Learning Forum. While the webinar is virtual, the Insight Learning Forum was a physical meeting where we had, panelists, experts, partner organizations, people with innovative ideas. We gathered together somewhere in the city of Abuja, Nigeria, to discuss around digital innovation. And this year, that same meeting, we'll be having the second edition of Insight Learning Forum. The date for that event is the 31st of July, and the theme is Digital Innovation in Public Health Practice, Lessons and Impact. And it promises to be a very insightful meeting, an exciting meeting, an opportunity to network and also learn about innovations and innovative ideas that people are doing in public health. So we'll be putting out, more information subsequently on social media. So please do follow us and, ensure that you keep tabs on this event. On your screen, you'll see our social media profiles. You can scan to download. Follow us, to keep abreast of what we're doing. Thank you for joining. Thank you to our panelists. Thank you to our audience. See you at the next edition of Insight webinar. Thank you and have a wonderful day.
Thank you.
Thank you.
Bye.
Thank you.
Thank you.
Thank you.